Hello, my name is Brenda Lee Rodriguez, and I am Patient Engagement Lead for the Hispanic Hearing Healthcare Access Coalition. And this is our poster. We are talking about our building research capacity through the collaborative work in community engagement with different stakeholders, including patients like myself, Hispanics, Latinos over 45, 50 years old that experience firsthand hearing loss and all the communication dilemmas regarding screening, diagnosis, hearing tests, hearing devices, wearing them, and the challenges in communicating in these times of COVID. I invite you to explore this information in this poster and also to inquire more about hearing healthcare disparities in this population. Remember, we're here to help. Thank you. Hola, mi nombre es Brenda Lee Rodríguez y soy la líder de compromiso con el paciente de la Coalición Hispana de Acceso a la Atención Médica Auditiva. Hoy estamos hablando del trabajo de capacitación de investigación que hemos hecho con diferentes partes interesadas, incluyendo pacientes como yo, latinos, hispanos, mayores de 45 o 50 años, que experimentamos de primera mano el lidiar con todos los dilemas de comunicación en respecto a detención, diagnóstico, pruebas auditivas, dispositivos auditivos y cómo obtenerlos, cómo usarlos. Y muchos de los desafíos de comunicación que estamos experimentando en estos tiempos de COVID. Les invito a explorar la información de este cartel, de este póster, y a investigar más sobre las disparidades de la atención médica auditiva en esta población. Recuerden que estamos aquí para ayudar. Muchas gracias.
Welcome. My name is Eileen Wong, and I'm a clinical assistant professor and research audiologist at the University of Arizona. Thank you to everyone for sharing your time with us today. I am excited to talk with you about our poster titled Juntos Somos Mejores, Building Research Capacity Through Collaborative Community Engagement. This poster discusses a project that is led by Dr. Nicole Maroney of the University of Arizona and Dr. David Lee of the University of Miami. Last month, we celebrated World Hearing Day and launched the World Report on Hearing from the World Health Organization. This report describes a call to action across the globe to address hearing loss and ear disease for people of all ages. Importantly, the theme for World Hearing Day this year was Hearing Care for All. This theme pushes us to think about gaps that exist when we consider how do we provide the best services for all people. When we start to think about these concepts, we can immediately see that there are significant gaps along the research to practice continuum. And I say continuum because it lends itself to the idea of depth and levels of evidence. Also, it identifies that there are multiple omissions and that this likely differs among our population, especially when we think of marginalized and underrepresented communities. In some cases, we may lack the relevant evidence itself, or the struggle may be in accessibility and implementation of the evidence that already exists. I want you to take a moment to imagine a canyon where you have a patient on one side and the currently available services on the other side. Think to yourself, how are we going to get all patients access to services? What research do we need to support access to effective and equitable care for all of our patients? When we think about this research to practice gap, it would be easy to connect these two sides with a tightrope, and someone would be able to get across. But this is not an acceptable method for most people. We need to think more carefully and go back to our theme of hearing care for all. How do we connect research to practice in a way that is effective for all people? In order to make good healthcare decisions for ourselves and for our communities, we need to have strong evidence that can be effectively leveraged. And we need to have this information to help all people, not just those who are easily accessible or in positions of power or authority. When we think about it, it's probably going to take more than a tightrope to connect these two sides, probably even more than a bridge. We need to actually transform the landscape so that the gap does not exist. Now you may be saying to yourself, this sounds great, I'm tracking with you, but how do we do this? And a big part of this includes the need to transform our research practices. One population that faces hearing healthcare disparities is the Hispanic Latinx population. In terms of how we transform research practices, that's a huge question. And what I can do today is share with you our own example in this poster, which documents the formation of the Hispanic Hearing Healthcare Access Coalition as a strategy to build capacity around research interventions for Hispanic Latinx adults. This project seeks to support an approach to research that engages patients as partners in the research process. We also are going to be engaging diverse stakeholders on the topic of comparative effectiveness research that is centered on hearing healthcare. We hope to learn more about how we can prioritize research questions that are relevant and important to patients, and specifically Hispanic Latinx older adults. And finally, we also seek to provide strategies that can help research teams to align their efforts with the community needs and be respectful of cultural values. One thing you'll see as we describe the formation of our coalition is that much of our information is in both English and Spanish, just to try to make sure that we are accessible in terms of language. Although we know that not all Hispanic and Latinx adults speak Spanish, we do want to make sure that for those who do, the materials are available in Spanish. I would like to describe our coalition structure, which is represented by a circular design. The reason we chose this design is to illustrate shared leadership with increased coalition duties delegated toward the core. This organizational structure was chosen to emphasize the importance of all stakeholders and leadership equity. Truly seeing our collaborators as equitable partners in the process contrasts other traditional vertical organizational structures of leadership that may unintentionally minimize underrepresented voices. Supporting a transition to this type of horizontal leadership structure involves establishing rapport and relationships of trust. It is essential to help others to elevate their voice and to recognize the contributions that they can bring to the team. Also, within each of the circles, we do try to have diverse stakeholder representation. For example, for our core team, we have representatives from public health, from translation studies, from our community clinics, and with personal experiences related to hearing loss. Also on our poster, you will see a description of our collaborative approach to engagement, which discusses methods for engaging with the community and solving dynamic problems. We want to thank you so much for your time and attention. We would love to hear from you, engage more with you on these topics. We can also share with you some of our resources and activities that we've been involved in. Please feel free to reach out to us via email. We also invite you to become a coalition partner so we can grow the number of stakeholders that we have who are interested in helping to increase access to hearing healthcare for Hispanic Latinx adults. We are so thankful for you all joining us today. We hope that you enjoy the reading of our poster and the rest of the ArSHA 2021 virtual conference. Gracias and adios.